How do hepatitis B and C screenings work? Imagine catching a silent invader before it causes serious harm. That's what hepatitis B and C screenings aim to do. These tests are vital tools in protecting your liver health and preventing liver cancer. They work by analyzing your blood to detect the presence of the hepatitis B or hepatitis C virus, even if you feel perfectly fine. Early detection means you can get the right medical care in time to prevent liver damage, cirrhosis, or cancer. For hepatitis B, the screening usually involves a blood test called the hepatitis B triple panel. This panel looks for 3 key markers. The first is the hepatitis B surface antigen, or HBsAg. If this is positive, it means you are currently infected with hepatitis B, whether it's an active or chronic infection. The second marker is the antibody to the hepatitis B surface antigen, known as anti-HBs. If this is positive, it indicates you are immune, either because you received the hepatitis B vaccine or had a past infection that your body fought off. The third is the total antibody to the hepatitis B core antigen, or anti-HBc. If this shows up positive, it means you have been exposed to hepatitis B at some point in your life. Screening recommendations suggest that adults aged 18 and older get tested at least once in their lifetime, regardless of risk factors. Pregnant women should be screened during each pregnancy, ideally in the first trimester, to protect both mother and baby. If you have ongoing risk factors like injection drug use or exposure to infected blood, your healthcare provider might recommend more frequent testing. If your hepatitis B test shows an active infection, additional tests may be needed to assess your liver health. These could include liver function tests or imaging scans. If you find out you are not infected and not immune, vaccination is recommended to prevent future infection. Turning to hepatitis C, screening begins with a blood test for antibodies to the hepatitis C virus, called anti-HBc. If this test is positive, it shows you have been exposed to the virus at some point. To confirm whether the infection is still active, a follow-up test called the hepatitis C RNA test is done. If the RNA test is positive, it means you currently have hepatitis C. Just like with hepatitis B, universal screening for hepatitis C is advised for all adults at least once in their lives. Pregnant women should also be tested during each pregnancy. If you have risk factors like injection drug use or exposure to infected blood, regular testing is important. When active hepatitis C infection is confirmed, your healthcare provider will evaluate your liver health further. This might include liver function tests, imaging scans, or sometimes a liver biopsy. The good news is that modern treatments can cure most hepatitis C infections, significantly reducing the risk of liver damage and cancer. Screening programs are a cornerstone of liver disease prevention. Finding infections early allows for timely treatment and helps prevent the progression to more serious liver problems. Vaccines for hepatitis B and effective treatments for hepatitis C are powerful tools in safeguarding liver health. Remember, all screening and treatment decisions should be made in consultation with a healthcare professional, as individual needs can vary. Staying informed and proactive is your best defense against liver disease.